Good morning, Jack. My name's Julie. I'm your nurse today. I just need to get a few details off you. I'm going to give you some medicines through this little drip in your arm here, and it shouldn't hurt. But I need to check your details first of all. Is that okay? So I'm just going to check on your armband. If you give me your name. So it's Jack Black. Jack Black, that's right. What's your date of birth? How old are you, Jack? And your date of birth is 5th of the 2nd, 2009. 5th of the 2nd, 2009. And your health and care number is 336 458 9991. That's great. Okay, Jack, Mummy's here beside you, and as I say, I just need to check a couple of other things first of all and give you a little bit of information. So we're going to give you some medicine this morning. You're written up in your medicine cardex here, and it's for an antibiotic. And this is just to help clear your chest. You know the way your chest is a little bit sore, so it's just to clear your chest a little bit. And that antibiotic is called ceftriaxone. And we're going to give 1 gram, and it goes through this drip on your arm, so it does. It's written up, it's prescribed by Dr. Good, and it's for 12 o'clock, and it's coming up to 12 o'clock now. You happy enough if I give you that? And Mummy's here with you as well. That's great. One other thing I need to check just before I go, have we any allergies to any medication? And I see the doctor here, Dr. Good, has recorded that we've no known allergies. That's grand. And the very last thing I need to do is just check around the drip site here. So we're going to have a look just around the site. Everything's connected well, and it's dated at the side here. There's no signs of redness or swelling. And is there any pain? And there's no pain. That's great. So I'm going to leave you for a minute or two, Jack, and I'll be back shortly with your medication. So just going to prepare my medication. So going to double check with the medication that we've got. So we've Jack Black, we've already checked the patient's details, we've checked any allergies. And we're written up for ceftriaxone 1 gram to be given IV at 12 midday. It's coming up to 12 midday, it's due and it hasn't been given.
Lovely.
In preparation, I also just want to check how it's reconstituted. So we have ceftriaxone. So we can use our injectable medicines guide. Ceftriaxone, and here it says ceftriaxone 1 gram is which the medicine we're going to give an IV slowly over 2 to 5 minutes into a large vein and reconstitute 1 gram with 10 mils of water for injection. So I'll need 10 mils of water for injection as well.
Okay, lovely.
Okay, so we'll leave that there. We've got our prescription chart. Gather all our equipment that we're going to need. So ceftriaxone, this is our medication. Ceftriaxone 1 gram and expiry 2020. Yeah. Our water for injection, so water for injection 10 mils and expiry 2022. We will need a 10 ml syringe. We will need our filter needle, our PosiFlush, and it's PosiFlush 10 mils and again expiry 2022. Plus our Clinell wipes for cleaning the top of the vials. I'm going to wash my hands. And put on gloves. Put on the apron. And make sure my tray is cleaned appropriately. With an alcohol wipe, just ensure My tray is clean. Take my 10 ml syringe. Make sure that packaging is intact and it's in date. Okay, so I'm going to open my syringe and then take my filter needle, attach my filter needle to the syringe. So again, you want to check packaging is intact and it's in date. So just ensure the needle is attached. Okay, got medication. We've already checked it. Take off the bung at the top. And using my Clinell wipe, clean the top of the amp for 30 seconds. And allow that to dry. Using another Clinell wipe, I'm going to take my water for injection or my diluent, and again clean for 30 seconds and snap the top. I'm going to drop my diluent, so I should have 10 ml of water. And again, ensure that you have 10 ml of water in the syringe, no bubbles. And add to your powder amp. Okay. And ensure the powder is well mixed with the water. And that there's no residue in the bottom. Perfect. And you should have 10 ml of reconstituted antibiotic.
$10
ml. Move into the sharps. And before placing it in the tray to take to the patient, we're going to ensure that a cap is applied. And before we approach our patient, we're going to take our Posi flush, put it also into our tray, along with 2 Clinell wipes to ensure the port is cleaned. Okay, so we're going to administer our IV medication now. So whenever I approach the patient, I'm going to ensure that I have my appropriate PPE on. I have my antibiotic and my my antibiotic and my Cardex with me whenever I approach the patient. So again, you're going to introduce yourself. Jack, hello. I have this medication just to give you now. Are you happy enough if I give it to you now? Is Mummy happy? Mummy's going to sit with you as well. So you just let me know if at any time it feels cold or it's sore at all, but it shouldn't be. Everything should be fine. So before I give it, I'm just going to double check a few details. So can you give me your name again? Jack Black. Okay. Jack, and how old are you? You're 11 years old, that's right. So your birthday's the 5th of February 2009, 5th of February 2009. And your health and care number is 336 458 9991. Okay. So we've definitely got the right patient, definitely got the right medication, and you've no allergies to medication that you're aware of. Great. So we've ceftriaxone, it's a little antibiotic, and this will help make your chest a little bit better, okay? It's due for 12 o'clock and it hasn't been given. Okay. So Jack, I don't need to, there'll be no needles or anything involved. All I'm going to do is put the medicine through this little port here, okay? Might feel a bit cold, but it shouldn't be sore. So before I give the flush, I'm going to clean the port. And we're going to clean for 30. And then we'll allow that to dry. Okay, I've got my flush, which is Posi Flush, and we've already checked the expiry date, which was 2020-08. So I'm going to flush using a push-pause technique, 2 to 3 mils. Just undo your clamp. And it's push, pause, push, pause, push, pause, push, pause, push, pause. And at the same time, just checking to make sure that the end of the cannula isn't red or inflamed or swelling. So we have 3 mils put through. Now I'm going to give the antibiotic. And the antibiotic goes in very slowly, so it's a slow bolus injection over 2 to 5 minutes. So it's roughly about 0.1 of a mil every 10 seconds. So two minutes, and we're nearly done. Okay, Jack, almost finished. Before we finish, we just want to put some more flush through here to make sure it's running well. And again, push, pause, push, pause, push, a little bit of positive pressure. Close the clamp. Okay. Jack, that's me all done. Was that okay? Did it hurt any? That's good. Okay. So, that's all the antibiotic you need. Just one dose a day. So that's your antibiotic for today. If you need anything else, you just say to Mummy or you ask any of the staff and we can get you that then as well. And I'll dispose of the equipment. So, make sure everything's disposed of appropriately. In the sharps box. Clean my tray. And remove my PPE. And before I leave the patient, I'm going to make sure that I document on the patient's Cardex that the antibiotic has been given. So today's date is the 29th. of the 7th. It's 12 o'clock. I've given it. I'm going to get my second checker to sign it, that it has been witnessed, and I will record in the patient's notes and also on their VIP chart.